and good day. My name is Jürgen Steinmetz from eTurboNews, and this is a breaking news update. For more news updates and shows, please go to youtube.com/travelnewsgroup, youtube.com/travelnewsgroup. Here's our update.
Newly released by CDC, American Health Threat. By region, the South had the highest prevalence of physical inactivity, 27.5%, followed by the Midwest, 25.2%, Northeast, 24.7%, and the West, 21.0%. More than 1 in 5 adults is inactive in all but 4 states, according to new state maps of adult physical inactivity prevalence released by the Centers for Disease Control and Prevention, CDC. For these maps, physical inactivity for adults is defined as not participating in any physical activities outside of work over the last month, activities such as running, walking for exercise, or gardening. State and territory level estimates of physical inactivity range from 17.7% of people in Colorado to 49.4% in Puerto Rico. In 7 states and 1 territory, Alabama, Arkansas, Kentucky, Louisiana, Mississippi, Oklahoma, West Virginia, and Puerto Rico, 30% or more of adults were physically inactive. By region, the South had the highest prevalence of physical inactivity, 27.5%, followed by the Midwest, 25.2%, Northeast, 24.7%, and the West, 21.0%. Getting enough physical activity could prevent 1 in 10 premature deaths, said Ruth Peterson, MD, Director of CDC's Division of Nutrition, Physical Activity, and Obesity. Too many people are missing out on the health benefits of physical activity such as improved sleep, reduced blood pressure and anxiety, lowered risk for heart disease, several cancers, and dementia, including Alzheimer's disease. The new maps are based on combined 2017 to 2020 data from the Behavioral Risk Factor Surveillance System, BRFSS, an ongoing state-based telephone interview survey conducted by CDC and state health departments. This is the first time that CDC has created state maps of physical inactivity for non-Hispanic American Indian, Alaskan Native and non-Hispanic Asian adults. The demographics of physical inactivity. The maps point to notable differences in physical inactivity levels by race and ethnicity. Overall, Hispanic adults, 32.1%, had the highest prevalence of physical inactivity outside of work, followed by non-Hispanic Black, 30.0%, non-Hispanic American Indian, Alaskan Native, 29.1%, non-Hispanic White, 23.0%, and non-Hispanic Asian adults, 20.1%. The maps also show that 2 states, Alaska and Montana, and Guam had a physical inactivity prevalence of 30% or higher among non-Hispanic Asian adults. 5 states, Arkansas, Kentucky, Mississippi, Oklahoma, and West Virginia, had a physical inactivity prevalence of 30% or higher among non-Hispanic white adults. 27 states had a physical inactivity prevalence of 30% or higher among non-Hispanic American Indian, Alaska Native adults. 23 states and the District of Columbia had a physical inactivity prevalence of 30% or higher among non-Hispanic Black adults. 25 states and Puerto Rico had a physical inactivity prevalence of 30% or higher among Hispanic adults. Physical activity can benefit everyone. Lack of access to safe and convenient places to be physically active may contribute to the observed racial and ethnic disparities.
Thank you for listening to our news update. There's more on youtube.com/travelnewsgroup, or you can read us, of course, in going to our news portal at eTurboNews.com or travelnews.online.